Morning, Les.
Morning, David.
Oh,
Catch me on my drink there.
I timed it just right. I did it.
Yeah, you did.
I've been trying to do that for a while. So anyway, this morning we're talking about a topic. So we're at Dynamic Healing Moments with myself, David Hanscom, retired spine surgeon, not really retired, but not actively doing surgery. And then Les Aria, very experienced pain clinician, psychologist at Kaiser System. And we have had lots of success with our own styles of actually healing chronic pain. And one thing that's become up, we've also dove much deeper into the neuroscience the last 5 years. And then Les was trained with Dr. Gewirtz, who really has understood this for many decades. I mean, much longer than I have, for sure. And the stuff we're presenting has really been in the medical literature for over 20, 25 years. This is not new news, what we're talking about. But the one thing I want to talk about today is called phantom limb pain, where we knew this in medical school that you lose an arm or a leg, and over 55% of people still feel this. First of all, 90% of people feel phantom sensations, but over half of them feel the same pain they had before the amputation. Because before the amputation might be diabetes, lack of blood supply, or trauma, really badly traumatized limb. So there's often a lot of pain in the limb before the amputation. So the pain is bad. There's also a study of 18 patients who had arm pain with completely normal arms, and they amputated these arms in an effort to get rid of the pain. Guess how that worked? These were normal functioning arms, and they were hurting so badly they had the arm amputated, it didn't work. So my question is, how did the surgeon do 18 of these before he actually stopped doing the amputations? It's crazy. Anyway, the illustration of phantom limb pain is sort of the essence of what we're dealing with chronic pain, because you know that chronic pain is memorized. After 6 to 12 months, it shifts to a different part of the brain. And chronic pain is a neurological problem. It is not a structural problem. Even if there's a structural beginning to it, like with amputations, why once it's memorized by the brain, it is there. The same thing happens with your thoughts. You get these repetitive thoughts over a lifetime. A lot of them are based on cognitive distortions. And with repetition, they become embedded in your brain, become these spinning circuits. And whether you think the thoughts or ignore them, you're still paying neurological attention to them. We know if you suppress something, you think about it more. But the metaphor I like to use is that of a basketball in your finger that you keep spinning. You keep spinning the basketball. So any attention given to these obsessive thought patterns actually makes it stronger. So there's ways of breaking up these circuits, but they are not subject to rational control. So I call it phantom brain pain. So phantom pain can occur anywhere in the body. There's burning mouth syndrome, there's ringing in the ears, there's all sorts of other pains in the body. So phantom pain can occur anywhere in the body, including your mind. So that's a term I used a few years ago. And by understanding the neurological nature of chronic mental and physical pain, it's the same set of circuits, types of circuits. It's a solvable problem. Dr. Aria, how do we solve this problem?
Yeah, it's called changing your life. And so one of the things, as you were talking, I'm reminded by the fact that, you know, very often when someone, a doctor, a surgeon, believes that this is the problem, we now know that when pain is chronic, your brain reorganizes itself. And so just to keep in tempo with what you're saying, sometimes it's so hard to believe that the pain is not coming from your spine, it's not coming from your ankle, it's not coming from your joint, it's coming from the brain. And a great analogy here that I'd like to use is a sprinkler. If you look up in the ceiling of your room, you most likely have a fire sprinkler, or in the household or wherever you are. Now, can we even say this, can we agree on this? So people say, well, my pain is not in my brain, it's in my back. I say, well, let's just say your back pain is the sprinkler. And let's agree that pain comes from that's the water. And where's the tank?
Right.
And
right.
That's the point. So what you're saying, and I have one more thing here to say. David, you've been a surgeon for, 30 plus years. That's a crap load of experience. Hey, David, have you ever operated on someone like hip or back or anything like that where they didn't need anesthesia? I mean, like major surgery, never.
No.
Right. So think about this. Point two is pain comes from the brain. That's why they knock you out when they do surgery.
True. No, you're dead right.
Right. So that's my point. So whenever someone says, no, it's not my back. So this is the cognitive shift or the paradigm shift that we're really trying to get people to see is the pain is actually manufactured in the brain. And you need to have different set of skills on how to work with the pain.
Well, remember, your brain is getting data from all sorts of sensors, your eyes, your ears, nose, skin, whatever. Your thoughts are actually a source of data also. But your brain has, if I touch this table isn't hot. Why? Because my brain says it's not hot. So remember, pain just says danger.
Yep.
So, but we mixed up acute pain, which is protective and necessary, with chronic pain, which is actually not very functional. In fact, it's sort of a disaster. So with chronic pain, the actual pain has been disconnected from the environment. Is that a fair statement?
Yeah, exactly. It's basically the brain has decided to sensitize that particular part. Why? That's a phenomenon in of itself. But what we do know is pain does come from the brain and it can be retrained.
But the metaphor I want to leave people with today is just picture these little dust devils in the desert. They're these little mini tornadoes that are spinning away all over the desert. And there are trillions of thoughts in your brain. There are trillions of these little dust devils in your brain. And they're not subject to rational control. That's why by trying to fix these things, you're inadvertently making them worse. So you and I both know you have to separate from these things and move a different direction. So you can create new circuits on your terms. You can challenge and regulate your own body's chemistry. So by moving a different direction to where you want to go, as opposed to paying attention to what's wrong, you actually solve the problem. So honestly, that you crowd out the pain, you actually, as you use these circuits less, they start to atrophy, just like any skill. As you learn to become a genius at not feeling, we become geniuses at feeling pain because we process it all the time. But we're especially geniuses about how to live our life. So right now, Dr. Arya, we're waiting for a lessism. So we're right here. We're waiting for some lessism. So Dr. Arya, how do we fix this?
Yeah. How do we actually relate differently to it? Surgeons fix, psychologists transform. So, on a serious note here, is one of the things we want to do is the best message I can send everyone is really learning how to relate differently. And that means is if you can look at this differently, if you recognize that the pain that you feel is actually coming from the brain, the big reservoir of ours, that's one. The second thing I want you to know is when you tighten up into the pain, it actually magnifies suffering. So the physical sensations or mental sufferings, cognition, and it's easier said than done, but the goal here is to relax into the pain. And how do you relax into the pain? You use your breath and you just observe it for a few minutes. And for those of you who want to practice something a little bit more lengthy or something more of a skill, my recommendation is what David has mentioned here last week, and I believe even the week before, is something called pendulation. Pendulation, Pendulation. Pendulation, you can find that on my YouTube channel on mindfulness, that's with the Y. Practice that because that reduces the resistance of what you usually like and how you react to it. So when you're reacting to the pain, you need a set of skills on how to retune the nervous system, because when you relax into the pain, it sends a new experience to the brain. It takes time and practice, much like anything else, to grow a garden, right? It takes time to practice. So you need to water it every single day.
Well, I agree with that. I'll say one more additional thing. I'm going to have the last word today. You had the last word the last 2 days. So I'm not that I'm keeping score.
There we go. There we go.
Is that phantom brain pain or what? Okay, here we go. But I mean, that's what the expressive writing does also. In other words, for a long time, people won't write down negative thoughts because they're afraid of them, honestly. But we now know that thoughts are as real as this chair or a table. So there's a reason why you're afraid of your thoughts. So you talk about pendulation, you can do it with your injured body part, stress it a little bit with intolerance, but you can also do it with your mind. And for me personally, actually coming out of severe obsessive compulsive disorder, which is a really bad phantom brain pain, the writing is something you can write what you tolerate, tear it up, write again, tolerate it. And sometimes you can write some more distinct thoughts, sometimes you can't. But the writing for 30 seconds, a minute, a half hour, whatever you want to do, is a way of pendulating with these thoughts. It's a separation exercise. And so again, you're rearranging your relationship to the thoughts. Is that a good last word? I passed. All right, this is dynamic healing. And again, Dr. Ari and I are putting on a workshop on August 14th. right? Do I have the day right, Les?
Yes, you do.
It's a Saturday workshop, and it's a day, and we're gonna go through these types of exercises. And so a lot of things we're talking about on Facebook Live will be consolidated into one day. We're excited about it because we've been able in general to get people with a very comprehensive view of things. See, once you understand the problem, you'll start finding your own solutions. So
Yeah.
can you remind me of the name of the workshop?
Befriending the inner critics.
Right, he remembers it because he's the one that named the workshop. So we're gonna have a good time in the workshop. A lot of it's just learning how to relax into the pain. We're actually gonna go through the exercises to help you do that. And so it's gonna be very interactive and we think entertaining workshop. We think we're funny. Nobody else does. My wife particularly doesn't think I'm funny. And you guys, you know, I failed a stand-up comedy class. So we won't promise humor here too much, but we're gonna try. Anyway, August 14th, it's on your website now also, Les?
Yeah, so yeah, it's in a Remedy Instagram. So, and you've got it up too. So, and so it's also on the opencenter.org. So if people go to opencenter.org, put your name or my name, it'll pop up. It's Befriending the Inner Critics.
Oh, all right. Thank you, Dr. Arya, and have a great day.
Take care.
All right. See you.